Greetings, this is a coronavirus COVID-19 update for 3/1/2020. And we start with China numbers as usual. This is Baidu, which is a Chinese search engine, and they have a page set up for the coronavirus. And the important numbers here are the bottom left cumulative diagnosis, which is at 80,174 now for China. And we have 715 suspected cases, up 141 from yesterday. That's pretty light. Cures are not really cures, those are recoveries, 44,518. Existing severe cases, 7,110. These are ICU cases, intensive care, and deaths now in China are up to 2,915. And if you scroll down on the same page, you see a map that doesn't change from day to day. It changed a lot at the beginning. I should probably take it out of here, but it does show you where Hubei province is, the dark one in the middle, and that's where Wuhan is, the epicenter of the outbreak. Then if you scroll down further, there's two graphs. This first graph shows that a lot of these numbers are up and down every day, if you noticed. Up and down and up and down, except for suspected cases is kind of on a downward trend. The number of deaths, 42 new deaths today, that's the black line. And cured, which is, like I said, not really cured, it's recovered. That's on an upward trend, but it's kind of up and down every day. And new diagnosed cases is down today, down actually the last couple of days, with 206 new cases. Then if you scroll down, you see the second graph, which shows you non-Hubei province. There's 10 more suspected cases in non-Hubei provinces. Hubei 196, and the total naturally would be 206 for all of China. Now, all of China and Hubei are basically the same line now, since there's not much going on in the rest of China. Then if you scroll down further, you see a list of provinces, and I was closing Hubei, which is open by default, to show all the other provinces, but there's not much going on in the other provinces, so I decided to leave it as default. You can see the number of new diagnoses for Wuhan, the city of Wuhan inside of Hubei province was 565 yesterday and only 193 today. That's way down. That's a drastic change. Then if you scroll down further, you see the hot stories of the day, which actually these are search terms for the hot stories of today. So sometimes you can't tell what the story is by looking at the search terms because they don't make any sense. But these are the top search terms that are affiliated with the stories that follow. So the first thing we'll take a look at is the suspension of ride. That's something that's a little surprising. So the first story on the left is, this is basically inside of WeChat, which is the Chinese chat application. So, and it would be like Facebook too. There's different sections of it, but there's also a lot of apps that run inside of WeChat, and one of them is, like Uber or Lyft, to get a car, to get a ride. So they're announcing here that they're suspending all rides from Wuhan to Hubei province, which you would think it would have been suspended before because Hubei is under lockdown. The roads are closed, but I guess people can get a ride, to the roadblock. But this, if there were people getting through the roadblock, they were probably delivering food and, using a car to do it for some reason. And that's been, halted now. Then on the upper right, the second story, they're talking about Italian residents who are protesting here and not wearing masks. But it doesn't, it's a story that they picked up in China, and it's a hot search topic, but it doesn't tell you whether these people are inside of the red zone, in Italy or where they're at. So it doesn't have much meaning. I mean, they're dressed in coats, so you'd think there'd be somewhere in the northern part of Italy because the south now is, it's kind of springtime there. And then what else do we have? Oh, flights. So I don't know if China should get a red star for this. They have repatriated 1,314 Chinese citizens from other countries on 10 different flights. So they had some Chinese people stuck in other countries and they brought them back. Well, every other country in the world's already done that a long time ago. And then what else is going on? We have China-Korea flights and China-Japan flights continue to decrease. They say that the Korean flights are further reduced to 276 flights a week. China-Japan reduced to 263 flights per week. And on the upper right, Tianjin, which is a city that is very close to Beijing. It's south and east of Beijing. It's a coastal city. That's the city where you had that really big chemical explosion a couple years ago that left a, crater the size of, a few football fields. There's, the Tianjin Civil Affairs Bureau canceled this festival. I don't know if this is like, the Tianjin grave sweeping ceremony. That's usually when families go back to their ancestors' graves and leave flowers, and they also leave these crazy, paper cell phones and paper fake money so that they can, make calls in the afterlife. But I don't know if it appears to be just a Tianjin festival. So it's not the national grave sweeping ceremony, probably. But anyways, that was canceled in Tianjin. So that's it for what's going on in China. Now I use this Johns Hopkins. It's a research institute, the Center for Systems Science and Engineering in Johns Hopkins, probably the university, not the hospital. And I use this every day because this is a really good global tracker for the rest of the world, and China. So the first thing I take a look at here is China's most recent figure, 80,174 cases, compared to what we have, which is 79,826. So that total confirmed on top would go up a little bit because we're a little behind there. It's not. Sometimes it's off by several hundred. It makes a really big impact, but we're still in the 88,000 range globally. Then the three hotspots outside of China recently for the last week or so has been South Korea, Italy, and Iran. And you can see not only is it impacting the total numbers, if you look on the right, the total deaths, we have Hubei province has the most deaths of any province in the world. And then we have Iran with 54, Italy with 34, and South Korea with 17. Those are, moving up the list of Chinese and other world areas. Henan province is to the west of Hubei province, and that's the second most populated province in China after Guangdong down south. So, there's a lot of deaths in Guangdong, in Henan province, not anywhere near as many as Hubei, which is 2,761 now. But the number of deaths in Iran, Italy, and South Korea have moved up the global list. Then I always take a look at the stories here for South Korea first, and out of these three hotspots. So there's not much new news coming out of South Korea as far as where these cases are coming from, because everybody knows that these cases are coming from that crazy church that has 1,000 different locations in South Korea and 450,000 members in South Korea. So there's a few stories involving that. One is that the churches across South Korea were closed on Sunday just to prevent the spreading of coronavirus. And then there's an article here that the factory activity, exports, factory productivity is down and exports shrinked to a 6-year low, which is not too unexpected. We also have some K-pop news again today. There's a K-pop star who's had staff members who were tested positive, so she's in self-isolation. And then lower left from MSN, don't you love it when these news services have advertisements at the top of the page that don't scroll off when you scroll down, so they give you 1/2 of a page to read the article? That's craziness. Anyways, this is where South Korea is thinking about, charging this church because of their reckless disregard for people, in the way that they infected a lot of people in the healthcare system. So I don't know, how much truth is to that. I mean, it's probably just, they threatened to do it just to show the church that, it's a big deal, but I doubt if they'll get away with it. Then the second one, news out of Italy. Italy has still not figured out how the coronavirus started, but it started in the northern provinces up close to the Alps. It could very well be people from Wuhan who went on a ski vacation in Italy. That's probably the most likely cause, but somehow they've got coronavirus and it's going like crazy. I didn't mention this for South Korea, but they went from 3,500 to 3,700 cases, so up a couple hundred. Italy went from 1,128 to 1,694, which you can see that on the headline here. The cases jump, 50%. But, I looked all over. I also searched in Italian. It doesn't say whether these cases, they're across Italy, but how many of them are in the red zone, the actual zone in northern Italy that's the hot spot in Italy. There's other cases outside of there. There's cases in Rome and, some coastal cities, including Venice, but they don't say of this 50% increase where these people are. Right? It's just across all of Italy, but you have to imagine that most of them are in the red zone. Then what do we have? Iran, made a statement yesterday that the cases should die down. Well, the reason there were big outbreaks here is because, they had a big pilgrimage to this religious site, and people from all over, neighboring countries were going there. Some countries announced, a ban to travel to Iran because of the outbreak in Iran, and but it's over with now, and right now they have a photo here of them disinfecting the religious site. Of course, that's after the fact. That's after it's over with. But, I don't know why they said it would peak today, because the incubation period is still a couple of weeks. So, and it was just locked down. It ended today, it ended yesterday, actually, Iran time. Today, U.S. time. So anyways, Iran is at 593, or was at 593 yesterday and up to 978 today. And that number is probably low because the number of deaths is 54. And the mortality rate to this virus is 2.3%. So there should be a lot more people infected in Iran to make 54 deaths. So we'll find out in the next few weeks. And we don't know whether Iran is reporting things correctly either, but that number should go up. Then what do we have? We have others in Japan. I put these both on the same page. This article coming out of the Washington Post says the last of the Diamond Princess crew disembarks. So, and then, something about New York we'll cover in a little bit. So if the Diamond Princess crew, if the ship is empty now and the crew disembarked, that's because, the last few countries disembarked their crew, repatriated their citizens back to their country. The United States did that a long time ago. The same weekend that Australia did it, and Canada, and I don't know who else, but the U.S. brought all their citizens back. And yesterday, I think India must have brought all of their citizens back. Most of the crew was either from the Philippines. The Philippines repatriated their citizens like 3 or 4 days ago. There were 445, I think, if I remember correctly. That's a lot of Filipinos, I'm sorry. And, that's a lot, of the crew. That's, basically most of the crew is Filipino. And then India had a couple hundred, and they had to post signs on Facebook saying, help me, before India sent a plane. And I think that plane arrived yesterday on Sunday, India time, and they picked up all of their people and brought them back. But it doesn't say anything about what happened to these 69 Indonesian crew members, because Indonesia said, we don't want you back. We're afraid you're going to infect everybody. So I don't know, maybe Japan just took them off the ship and put them somewhere. So I don't know. If they're smart, they would put them in isolation, because the crew members have a large instance of, infections. Yesterday's video explained that. Then what do we have? We have some other countries that are popping up in numbers. France going from 100 to 130, Germany from 79 to 130, and Spain from 45 to 84. So we'll take a look at these. France, isn't saying much about, where their people are coming from, but a lot of these French infections came from visiting Italy. So that was announced a couple days ago, and have to assume that it's still that way. So the news out of France today, they confirm 130 coronavirus cases, which is what Johns Hopkins shows. And then also another article coming out of France was they shut down the Louvre Museum, and that was not a big surprise. They're trying to, just like every other country, trying to shut down a lot of large gatherings of people. Then in Germany, not much in Germany. I had to look this up in German, to get any news at all. And then even then, it was just scattered and bad stuff. So I went to, this is World, the German name for world. It was just a couple months ago. I took another German test, and they said I was still fluent in German, speaking like a native, but I still have to look up words every so often. So anyway, so we see a bunch of people here in a room looking at the same stuff we're looking at. They have the Johns Hopkins site up in the background. So these are health officials. There's no hot news. And if you go, on the right, it shows the country map. The first case was in Berlin yesterday, they announced, but there's scattered cases all over Germany. And then what do we have? Spain. Now, the only place I could find this is on YouTube. Spain says most of its COVID-19 cases are linked to Italy, so no surprise here. That's how Croatia got their first case, and a lot of countries that are in the immediate vicinity of Italy. Spain is not exactly in the immediate vicinity, but still there's a lot of Europeans. It's still winter. So in Spain's pretty mild climate. So if you want to go skiing, northern Italy is a good place to go. Then what do we have? The U.S. The U.S. went from 70 to 76. So lots of news out of the U.S. today. One is from the CDC, which they announced this, preventing spread in communities. Probably a little bit jumping the gun, but the information's up there. How to avoid, how to prepare at home, at school, and at work. Then the FDA announced that they're, investigating the supply chain of medical supplies. If you've searched for a mask lately, which I have, I'm not in need of masks, but I just thought I would search, and you can't find a mask anywhere if you go online to Walmart or any place, and everybody, Walmart shows these things. Actually, they pop up in my Facebook because I was searching for masks, and as soon as you hit the link and go to Walmart, they're out. It says not available. So, they're investigating the supply chain, and right now the supply chain of masks are, the whole volume of mass produced in the United States is going to the medical industry, to healthcare people, and that's the way it should be. And people don't really need masks yet. And then we have the National Institute of Health announcing that the clinical trial of remdesivir has begun in the United States. Now, I think that already started in China. This is a new drug. It's a new AIDS drug, and the U.S. the first case in the United States was in the Seattle area or up in Washington somewhere, and that person was in really bad condition on a respirator and tested positive for COVID, and they gave him this drug, and the next day he was practically recovered. A drastic improvement in his condition. So this is one of the AIDS drugs. The United States supplied China with a lot of different AIDS drugs, and this is one that was the most recent one that was sent to China. And I don't know how many dosages they gave him, but that's the reason the CDC wanted to go there to Wuhan or to China, is to oversee the clinical trial, because China, every health institute and hospital and health organization, they want to do their own trials. They mix together a bunch of drugs, like the previous batch of I think 4 or 5 different AIDS drugs that the United States sent over there. They're trying them in different combinations. Well, that's not how you do a clinical trial. So the CDC had to go over there to monitor the clinical trial of a few drugs, and I'm sure this is one of them, because this is the most promising drug that we have. So anyways, this clinical trial started in the United States, and where is it? Nebraska? Yeah, Omaha. So that clinical trial has started, and there's one that's already underway in China for this drug. Then what else do we have? 2 more COVID-19 confirmed in King County. This is in the greater Seattle area. 2 Bay Area healthcare workers are presumptive positive. This is what's really crazy. When you presume somebody's positive and you want to give them a test, you have to send this, blood samples to the CDC, which is crazy. We have this was addressed in yesterday's video, but the CDC, after we had a person die, they finally said, okay, we got to change the testing procedures. And then a UPS worker is one of the 2 in the this is kind of confusing because it's the same news, but this Como news is coming from the Seattle area. And on the upper right, we have a woman in New York has coronavirus after traveling to Iran. There's a travel ban to Iran for a reason, and then now there's it's a hot spot for coronavirus. So why Americans have to go there to this pilgrimage site, I don't know why. But this person is isolated at home. Then what do we have? Despite COVID-19, let's see, you should stop buying face masks. I'm going to make another video on these face masks, because this is just crazy. I keep on seeing the wrong face masks posted in every news article, and even health officials, wearing the wrong mask. These masks here in this picture have a exhale valve, which means your exhaled air is not filtered, which means if you have coronavirus, so does everybody around you. If everybody's wearing a mask, then, it's going to mask what you inhale, and you shouldn't get coronavirus. But this is not, there are no virus masks that have an exhale valve. So I'll do another thing on that. And what else do we have? State of Illinois, just 1 more presumptive case. And that's all that's going on in the U.S. We went from 70 to 76. And a lot of these are community people that, that just pops up. They don't have any explanation for how they get coronavirus. And the last thing I look at every day is the graph that, you can enlarge this. It's on the Johns Hopkins site on the lower right. And you can just see that after leveling off, the number of cases is starting to trend up again. And that's because of hotspots outside of China. Thank you. That's all we have.